Hello there, doctor. Now, today I have Dr. Sandish Pandit. He is a board certified sports medicine doctor, family practice, and sports medicine fellowship practicing in Oregon. At this time, he's in private practice. And how long have you been in private practice, Dr. Pandit?
It's been about 15 years now.
Okay, wonderful. Yes, you look very young. I was afraid, I knew it was in the teens, but I wasn't sure exactly. But we want to highlight Dr. Pandit today because he has a very unique story that we want to highlight. And one of the things I want to do that is because Dr. Pandit is in private practice. He does sports medicine with regenerative medicine as well. And he wanted to focus on teaching women how to run more efficiently because he himself is a marathon runner himself. He started doing it after 40, and we started working together around January of 2026. And I wanted to highlight his achievement and what he's able to do to overcome the fear that we normally have of doing something new, get out of our comfort zone. And really, he punched fear in the face and say, you know what? I'm just going to do it anyway. And I'm just going to make it work with DoctorBoss coaching program help. So, Dr. Pandit, what I wanted to ask you is why did you decide to get out of your comfort zone and start a YouTube channel?
Thank you, Anne. Anne mentioned I am Dr. Sandish. I'm a sports medicine doctor. And just like all of you guys who are watching, I also spent years of training in medical school, residency, fellowship, became expert in the field. But then we keep running into same frustration. We had 15 minutes with the patient. They have a lifetime of question, and I cannot fully answer in that room. And then so when I met you and Dr. Bose, something clicked. You showed me the authority and expertise that we have spent a decade building. That knowledge has value far beyond the clinic walls. So that is why I was thinking of starting the video. And honestly, what we have seen, what I have seen after starting the video has even surprised me. So many people have, told me like that was so hard thing to understand me before. Now I can understand it clearly. Now we were talking about the fear before the starting of the videos, and obviously you have worked with me and you know how it went. But I think for folks like me, the biggest fear that we went through, and this applies to so many of us, is that there's something called imposter syndrome, which is like persistent feeling that you're not competent as other perceive you to be. And then despite your credentials, your years of training, your years of experience, you are still not competent enough. So this type of the feeling is incredibly common among high achievers, and then physicians definitely we are affected in this group. So for me, when I was trying to start the YouTube channel after we worked together, for me, it sounded like this, like, who am I to make this video? There are bigger names out there. Also, what if colleague sees this and judge me? Or something like, what if I'm not perfect? And what is on the flip side, what if nobody watches me? So that type of the voice was going through the mind. But after this few months of experience, I can tell you that physicians, they have this credibility and authority like nobody else would have. The gap is not so much the credibility, it's the gap is between the credibility and the confidence to share it. The way I overcome it was kind of simple. I recorded the first video anyway. I didn't wait till I felt I'm ready because I know that will never happen. So I just recorded it, sent it to Anne's team, and then she handled the rest. So that's how the journey began for me.
But let's get into well, you said a lot of good things like, what would my peers think about me? I am not qualified for that. But why did you just say that I'm doing it anyway? I don't care what my peers think about me. How did you overcome that and just press record?
So that one, I always believe that if you ever feel like I would wait for this to be totally perfect because I would record first, it's a counterintuitive. How you get better is actually by doing this. We always learn to walk before we run, not the other way. So that's what I believe strongly, that once you start, things actually will keep getting better. You have to trust you. And looking at what you have done, the physician, all the career, you have all the reasons to trust you. So trust yourself, trust your gut, record the first video. Things will keep getting better from there. I can assure you.
Now, I want to put in context that Dr. Pandit had no YouTube channel, no social media, no experience recording video. It's not like he has been on social media for years and been recording videos. No experience of that at all. He started with 0 followers and really didn't even have a camera to even record or even a microphone as well. And so he started at the basic level as you can be. Essentially, confront fear in the face and just say, well, I don't really care. I'm just going to do what I want to do and not worry about what other people think about me. Why did you decide to sign up with the Inner Circle coaching program to help you achieve this goal?
As a physician, I do believe that we have all the expertise takes to be a good YouTuber. So if you think about what your everyday practice is, you go to the room, there's a diagnosis, you explain it to your patients, to the families, and you synthesize all the information, your years of knowledge and experience in a way that they can understand. So you are already a good educator, all the time communicating with patients, families. So you are a good communicator. That's what it takes, that you can explain, that you communicate well, that you have the knowledge. So you already have exactly what it takes. Plus the YouTube, it also rewards the degree, meaning like that what the algorithm rewards the degree. The trust is inbuilt into that one. So basically what we don't have is the editing type of these skills. And that is what the combination of you as a physician and then Anne's team as a Dr. Boss actually synergy and gives each other a very good compatibility, that you have this skill and has a team that puts the video together. So it's a great combination. For me, if I start editing, it's going to take a long time. Probably I would not be able to do it. But all you have to do is record, send it to Dr. Boss. They will do the editing and you do what you know how to do it. That's being a physician. So that works perfectly.
Awesome. And then also working with me and Mike, how did that kind of help you get started in the beginning?
The experience was very good. So initially, we have to realize that YouTube is, we talk about YouTube being a very good space for the physician, but on the flip side, you also have to realize that YouTube is a business where 99% of the people fail. Only 1% survive. So there is a game that the YouTube and then the thumbnail and the SEO and all that different things that we don't never hear about or worry about, those things come into the play. So if you have a team that is very trusted and who had done this for many years, and you can send your video to them, so you can rest assured that they follow all the things that is necessary for the YouTube to recognize your video and take it up in the algorithm. My experience with working with Anne, she does that first, like what is it that takes to build the algorithm, how to make the video so that it actually, the algorithm rewards that, so you know what is behind the curtain. So that knowledge is very essential to be successful in YouTube. Plus, she has a team of editors who have been doing this for many years, and they are very good in communicating back and forth with you. So once you record, then the communication begins. It's very seamless. So that's what I have found. The experience couldn't be any more pleasant than it is.
Thank you for that. Appreciate it. And, I want to highlight you in put in contact. Dr. Pandit started with 0 followers. His first video was published on YouTube on March 12th. With 0 following. And now, as of third week in May, he is at over 300 subscribers. Let me tell you and put in context what that means. So it's only been, let's say, 2 months. He's grown to 300 subscribers. Most channels stay stagnant at less than 100 subscribers in years. So his achievement within 2 months to grow 300 subscribers is through niching down on his topic and who he is talking to and what the video strategy is about. Now, all his videos have been produced by us meeting together for strategy. So, kind of tell us, Dr. Pandit, about what was the most difficult part of recording the video, and then how did you overcome that?
Yeah, for me, I think the most difficult part is again, the first video is always the most difficult part, but not so much because you don't know the content, but it's just the made of fear in your mind that maybe I'm not good enough, or like maybe somebody would judge us. As for other things, we are already telling patients what to do. We're already educating them. We're already communicating with them. That is what exactly we're doing in YouTube. Only difference is, instead of doing it in the room with the patient, here we are doing it in front of a camera. That's the only difference. But having said that, for me, that was the most difficult part. Like, how do I do this with the camera? So I do remember one time we had fellow physicians who were in the Zoom call, who shared with me how they overcame the fear. There are some tricks that folks use, like maybe do something kind of relaxing, whatever you feel like before, maybe sing a song before. But ultimately, what it is you just hit the record button after all that and trust yourself that when you do that, the first one, maybe it's difficult, the second one gets better, and then things will just keep getting better from there.
You're currently on your seventh video. So, how do you feel
Yes.
now on your seventh video compared to your first video?
So much different this time. If you actually have the script and then tell me that, okay, this is the video that we're making, I'm comfortable that I can start doing that right away. I can sit down and then get familiar with the script and then start doing it, versus the first one. Remember how many takes I did? There were multiple takes. The fear, like maybe I'm breathing harder, so the physical symptoms as well, so all of them were there. But the only thing that actually really makes the subsequent video actually easier is to record your first video. It does not has to be perfect. When people look at it, some human errors, people actually, they are okay with that rather than the AI saying things perfectly. So I think trust yourself is that, again, once you record the first video, things will start getting better and perfection will come, but you don't have to be perfect to start the first one.
Absolutely. So, how has starting a YouTube channel focusing on running, how has that changed you personally as well as how did it affect your business? Let's start with personal. How has it changed you in a way, or it hasn't?
No, definitely. I do feel, especially in the area of the communication, how you present even within patients, with families, you do get that confidence that you were not before. Talking to folks in maybe business setting, wherever, communication is big part of our life, and communication is one tool that we all want to master. So I do feel that I'm more confident than before, especially as far as the communication goes. Just like I said, maybe before I had so much of a reservation before recording. These days, if I have the script, I'm confident that I can go ahead and make that video in a reasonable time. I am not stressing about recording or anything. As far as the business goes, I have heard from multiple, like social media, as well as patients who have come and see me telling me that, oh, I watched your video and then you explain it so good. And for me, I take that kind of seriously. The ability to explain things, the complex medical things, in a simpler term, that is, I really took that to my heart. And then when they say that, and it really, I feel very good about myself. And business, I'm already seeing some impact, that I'm a sought out figure here in the community. I do expect that to grow with time as the channel grows. Just like Anne said, maybe we have about 300 subscribers with time. I do expect that to grow over the time and then positively impact me, my clinic, and then the visibility in my niche area as well.
Absolutely. So, starting a YouTube channel, have you seen an uptake in patient in the office at all, or any change that you see in the office, as in more phone calls or patients saying, "Hey, I see you on YouTube"?
Yeah, I have heard that all the time. So I want to say that, but I really have not put the number before versus after. So no head to head type of the comparison there. But I've been hearing from patients all the time. Yeah, I saw in YouTube, you look so good, or makes me feel good, or you explain things so good. But I have heard that all the time. Yeah.
Well, I hope it's okay for me to share how it was with Sandish' first video. He must have done at least 20 takes. At least. And
I
because,
agree.
one time he was talking too fast. Yeah, and maybe even more, Sandy. One time it was talking too fast, and I give him feedback, maybe slow down a little bit, and then we had to kind of like reformat how he talked and the things that to talk about, and we had to narrow down the video into like one topic instead of multiple things too. So I know that I can tell that he was trying very hard. He was definitely going out of his comfort zone in talking clear or slower and following the format that we normally have doctors follow, which is the hook, the credibility, and the agenda, what to follow in the video, and then the context, and then the call to action. I mean, everything, our mind is just something new to get used to. And was it at one point you just want to, in the first video, Sandy, is it any one point you want to just throw away the microphone and throw away the camera and just say, I am done?
That might have happened a couple times, no denying there. But first video was definitely nerve-wracking and it's stressing. But I do believe all of that moment do teach us something. But again, once the first video was recorded and then the second video and the third video, things got easier and easier for me. But the first one is always a nerve-wracking. But for anybody who is starting, I would just say, you've been doing this all your life. This is nothing new that anybody is asking you to do. All the difference is the camera, and then once you are used to the camera, then things would go very smoothly.
The next part was that why did you pick runners? Why did you pick women runners over 40? That is Dr. Pandit niche, because he has a passion for runners. And just to let you know, his first video was a very complex topic. It was about a VO2 max. Not only did he have to explain a complex topic, it was also his first video. So we had to break that in like two parts. Why did you pick that? I guess it is a sport because you're a sports medicine doctor, but why did we decide to pick that niche and you're so passionate about that?
Well, big reason is I'm 40 plus too. So in all seriousness, most of my life, even as a sports medicine fellow, I was kind of sedentary. And I started running mainly after 40 years. Only that time that I realized all the importance that running can bring in your life personally. I have shared this in one of my video as well, that in the COVID time, when clinic had to be closed and our source of the income was not there, the uncertainty and everything, I was in a little bit of a dark place. And then I was not sure how to come out of it. Nobody was certain. So that is when I picked up running. And I really felt good about the running and the sanity that the running brings to you. That was something very hard to describe in words. After when I started running, I actually even signed up for the marathon, but again, that marathon got canceled, but I ran that anyway. So I do personally strongly believe that running is something that actually gave my sanity back. Plus, there are so many other health benefits that comes with running. So running is really near and dear to me personally. And of course, this is my topics as well. What I realized, that's the reason I made the niche, that this is something that is good for your overall health, good for your longevity, good for your mental sanity. I wanted to make running for 40 plus people my niche because I am passionate about that. After that, I have last 7 years, I have run 7 marathon. So I feel pretty good about running, and I want to help people who want to run and stay active. So that's the reason I picked that niche.
Wonderful. And you can see in his background, those are his medals from all his marathon. So advice to
Right.
other
Yeah.
doctors listening to this. Yeah, there you go. Yeah, I mean, that's his credibility. Okay. So, advise to other doctors that are contemplating YouTube and or getting on social media and doing what you are doing, which is extraordinary, by the way. What advice would you give them if they want to start a YouTube channel but yet has not done it? And many of them, I have talked to many that started it and now has not recorded a video or has not do more than just one video. What advice would you give them?
So just like we're talking about, I do believe after talking to you and then doing some studies on it as well. Number one, own your niche. Don't try to be a general health channel. You're a specialist, so speak to your specific patient. Channels that find success by filling specific knowledge gap rather than talking about all general categories consistently outperform. So when you niche down, the right people will find you. So that's number one. Secondly, we have to realize that YouTube is actually world's second largest search engine. So this is something new creators don't fully grasp. If you are creating videos but they are not optimized, then you can actually be invisible. And that is when platform like DoctorBoss comes into the play, where you handle the SEO and all the optimization, and you can actually just do the recording. So that's great. Number four, realize that algorithm rewards the credibility and authority which you already have. So the credibility and authority you have is edge. No influencer, no blogger has that. And I would say other thing you have to realize is consistency definitely matters most. Consistency beats even the perfection. So rather than looking for the perfection, if you are just consistently producing new videos, then that channel will be successful in the long term. I would also think that YouTube, it's not so much short-term gain. Think long-term. So just like Dr. Ann was talking about before about creating some passive income, that aspect is always there. And of everything to a physician, if you are sitting in the fence, I would say this: your knowledge doesn't have to end at the door of the clinic. You become physician because you wanted to help people, and YouTube lets you help people who otherwise you would never meet them, in cities you would never visit, in hours that no office is open. So think about all the other added benefits that comes with it. You are already educator, you're already a communicator, you already have earned the trust in the room, you already communicate complex medical topics to the patient. You do this all the time. All you have to do it is in front of the camera.
That's very good because I've always said an influencer need three steps, okay? Authority, credibility, and then a following. Doctors already have two out of the three steps. As a doctor, you already have the authority with your training and being a doctor. And credibility is obviously your 12 years plus of training and in clinical practice. All you need now is followers on social media or on YouTube. And we particularly like YouTube because YouTube videos are evergreen. That means that once you publish a video, it can be shown multiple times over years. I mean, I have a video that I recorded 5 years ago that are still picking up subscribers and views. And what's good about YouTube is that they pay you once you cross over 1,000 subscribers and 4,000 hours of view. YouTube paid you for every video that gets viewed. So you're collecting income from that as well. But your videos are also forever versus Instagram or Facebook. You have a video or post there, it gets shown for a few minutes and that's it. It's like gone. It's not being shown again and again to your potential followers or your followers, day after day. So, having said that, the reason why I want to highlight Dr. Pandit was that he's like a lot of doctors. We have the credibility, the authority, and the expertise in our clinical background and knowledge that we can help millions of people, millions, believe it or not, that if you just record a video, that one tip that you may know, or that three things that you may know that will help a condition will really save somebody's life. I can't tell you how many times I'll read on comment on YouTube video and someone will say, I follow what you recommend in the video, and now I'm doing so much better. Thank you very much. You have changed my life. Now, have you noticed comments like that too, Sandy?
I have, especially after making the videos, I have heard from several patients that I guess I watched your video. I was struggling with that for so long. You can actually even see that in the YouTube comments too, that, wow, this is really had changed my life or changed the way I run. So, and like I said, the ability to explain hard things, complex things, that's near and dear to me. So that I do feel very good. And then that is, I have noticed that in my practice with patients coming and telling me, yes.
Absolutely. So you can have a reach that is outside your clinic and can really help thousands and even millions of people. And our passion here at Dr. Boss is to encourage doctors to punch fear in the face, get out there, share your knowledge to help thousands or even millions of people, and at the same time leverage your medical expertise online to create multiple sources of income besides just seeing patients in the clinic. And Dr. Pandit is on the beginning of his journey to do that, because what we perceive along with Dr. Pandit is his business model is that, produce video and then course along with an online coaching community, and then that will grow to a large amount for him to develop his brand and his influence. Then he'll start attracting sponsors for shoes, sponsors for equipment, for running, all the different types. So he'll be the authority in running. So he'll get sponsorship and he'll may even do a consulting deal. So it starts with the video, then it's monetizing with an online course and then an online community, and then attracting brands for multiple brand deals and sponsorship. That's how you build multiple sources of income outside of your clinic. But yet you can still do this while running a clinic. Now, Dr. Panda is still running a full-time clinic the whole time. So he's doing this on top of his clinic. So you don't have to quit your practice to do this. This is in addition, but you're building your online equity. I call it online real estate and equity over time, which then will build different portfolio for you, such as brand sponsorship, such as collaboration, consultant, and affiliate commission. Because now I think you started making some money already with affiliate. You did a video on running shoes, and I show you how to create an Amazon associate link. And if somebody click on that, Dr. Panda make a small amount of money, but some money, better than nothing, right? Have you started seeing some commission coming in from
I
that
have,
video?
I have. I shared with you last time. Yes, there is some money coming in, like you said, not a big amount, not that I can buy a new car, but it is so passive. So I actually felt pretty good about that because that was first time I earned something without doing anything. Otherwise, for doctors, every time you have to show up to make the money. There is no such thing like passive income. But this one, just integrating some affiliate link, you're able to generate some income. So that felt pretty good.
Oh, yeah. This is just the beginning, Dr. Pandit, because I see brand sponsorship coming in the future. And I started where you were. I started with 0 followers in 2021. And now we have built now 18, 19 sources of passive income. I think maybe 19 sources because things keep coming up. What we did was we started having a live event. We have a live event in January for doctors to help them leverage their medical expertise online with marketing. And I can foresee you, Dr. Pandit, doing a live event in the future for runners, almost like a runner convention type like thing, where focusing more on maybe just running efficiency, but very, very niche down. Anything is possible, doctor. If you have a vision and if you have a passion, you just need to take that step. Don't wait for things to be perfect. Don't wait for the right timing. Because in fact, Dr. Pandit wasn't ready to even work with us because he was traveling to Nepal. He was going to go to Nepal for like 2 weeks before he worked with us. And then he decided, I'm just going to do it and do it anyway. Is that true?
That's
It was not
true.
the right time for you, was
I
it?
was begging Dr. Truong that, okay, this is what's planned. Why don't we go ahead and just postpone it? Yes, I'll do it, but I'll do it at this later date. Just like we our brain come up with different excuses that, okay, maybe Monday, maybe January 1st. So I was asking like for January 1st. But then again, after talking to you, what I thought was, okay, if I at least go ahead and start right now, by the time I was thinking, I would actually be already making some video, and then I would be more comfortable so that I can do it in a consistent basis. And that exactly happened. I am so glad that you convinced me to start that right then, right there and right then.
Absolutely. Maybe, of course, there's never a right time to do the thing that you want to do. You just do it and then adjust as every day goes on. And I see this as the number one thing that doctors say, well, this is not the right time. My daughter's graduating this and this and this. And then guess what? After a year from now, where would you be? It's like, well, I didn't do it anything either. So once you start, you have forward momentum that you're going to follow. And I know Dr. Pandit, professionally as well as personally, it's not the same. It is amazing that when you're producing video, you're making content, but it somehow changes you. It changes who you are, how you communicate. It affects how you are in business as well. And your visibility and the opportunities that get opened up for you are endless, that will be opened up if you keep producing this video. I already foresee things for you that is in a year and a half from now, that I have seen in my journey as well, being on YouTube. And when I tell doctors that you can create 19 sources of income, they think that, oh, but and that's just you because you're just unique. That's not it. I just punch fear in the face and just do what things that I need to do and go forward. It definitely is imperfect. And did I make tons of mistakes? Tons of mistakes, but I learned from it and I pivoted and I'm better now than I was. And I know that the person I am today, it's not that I have grown exponentially since 2021. And I see Dr. Pandit being the same as well. I mean, what do you think, Sandy?
I totally agree with you. I do feel this has taught me a lot. The confidence that I have with the camera, with the people, I totally agree with everything that you said. It does changes you as a person, all in a right way.
Absolutely. So, having said that, I hope this was helpful. And just know that, as a doctor, you can be a Dr. Boss and leverage your medical expertise online for multiple sources of income. Thank you, Dr. Sandish Pandit, for being here today and sharing your journey with us. I look forward to bringing you back again to our channel to showcase how you have grown and what opportunities and doors will be open for you in the future.
Thank you, and thank you, Dr. Boss team, for building something that removes every excuse from the physician. This program works because it's built around one thing that physicians are already exceptional at, knowing their subject deeply, and then Dr. Boss program handles the rest. Thank you so much.
Take care. We'll see you in the next episode.